Okay, good afternoon, Miss Potts. How are you?
I'm good. How are you?
I'm doing great. Today we're going to be having a teaching session on pressure ulcers or pressure sores.
Okay.
Do you have any idea of what that means, pressure ulcer or pressure sore?
Some little.
Some little. Okay, great. That's no problem. So our main objective of today is to let you understand what a pressure ulcer is, what a pressure ulcer does for a patient, what complications, how you would treat that. Do you have any questions before we begin?
No.
Okay, if you have a question today throughout the teaching session, stop, ask. I would love to answer it, okay?
Okay.
So a pressure ulcer is one of the most common complications that hospitalized patients actually have. It is usually because the patient's unable to get up, they're unable to attend physical therapy. Usually they have maybe like a stroke, so there's something in their body or something that has happened to them that has compromised their ability to move. So we see this in especially those patients that aren't able to turn themselves, able to get up. So that's why we implemented the turn schedule for our patients to turn them every 2 hours. Also, we see that our patients that have more than one or two types of underlying health conditions, which could be an example of diabetes, are more at risk for developing a pressure ulcer. So there is something in their body that is not, they don't produce or like have a healthy body like me and you do, so they're already at compromise, which is risk, and then that allows their body to have more risk of developing a pressure ulcer. So a pressure ulcer is more likely to develop over an area that is bony. So that includes the back of our head, that includes our neck, our lower back, it includes our elbows, it also includes our buttocks region area. It also includes our back of our legs, our knees, and then our ankles and our feet. So we also need to make sure that we're checking those areas when we do talk to our patient, or if we're not moving, we need to make sure that those areas have a lot of attention to.
Okay.
So also, if a pressure ulcer develops, there can be the redness of the skin, and that's when we would apply a bandage or a patch over it to make sure that it doesn't bust. Or if the pressure ulcer is busted, we can call in wound care, and then we can also talk to the doctor about maybe prescribing our patients antibiotics to make sure that that pressure ulcer doesn't develop any further. So, can you tell me what causes I'm going to ask you a few questions. Is that okay?
Mm-hmm.
Perfect. So, can you tell me what causes a pressure ulcer?
It's a breakdown in the skin, like where a patient has laid in the same position for too long.
Okay, yes, correct. And so, 3 places that you would look for a pressure ulcer would include your elbows, the back of your head, and then your buttocks region. Can you teach those back to me?
Elbows,
Yes.
the buttock region,
Yes.
and your back.
Okay, the back of your head.
But
the back is one as well. So, good job. Okay, so now we're going to ask you, do you know what type of, what the doctor would prescribe for a patient that has a pressure ulcer? What type of medication?
If it just started, maybe just applying a band-aid and some kind of medicine to the area, or call wound care. And
yes.
maybe that's what they would do.
So what type of medication would that be? We discussed it.
The bandage, the wound care, the ointment, antibiotic.
Yes, antibiotic. Great, correct. Okay, and okay, so that sounds great. Okay, do you have any more questions about that? Okay, anything else you would like to add? Okay, Ms. Potts, I believe now that you have a deeper understanding of wound care and wound pressure ulcers. So if you have any questions, please reach out to me, and I don't mind educating you further on that. So I want to thank you for allowing me to have this teaching session with you. And at this moment, I would perform hand hygiene once again, and then I would exit my patient's room.